Okay, good morning, everybody. It's nice to be back up on the podium. So the questions that I'm going to be asking the panel, some of them relate to the employer side of the business, and some of them relate to on-site nurse coordination. And just to kind of set the stage so you're aware, we have two employer groups up here. We have two Aurora on-site nurse navigators as well. And each one of the nurses is paired with one of the employers. There's no clinical work going on site. It's more advisory support, coaching type of work. So the on-site nurses kind of work hand in glove with the employer's wellness programs. So as you hear each of our representatives answer, you'll know the perspectives that they're coming from. So this one is a question for the two employer groups that are represented here. We're going to get into the how does your program work, but let's start with a question around why. Why did you feel it important to introduce a wellness program into your organization?
We had a health program through a different health insurance carrier that was very stringent, very forceful, and it didn't work out for us. So we were looking for something a little less pushy and a little bit more friendly.
Okay.
Good morning. At Dental Associates, given that we are a healthcare organization, dental is so closely aligned to overall health, and that's really one of our goals for our staff as well. So it's very important for us to invest back into our staff and their wellness.
Excellent. So the next question is really around kind of a high-level summary of the program that you do offer. And then I'd like to follow up with each of our on-site nurses to comment on how they've worked to fit into that program and augment what you were already doing. So Julie, can you give us a brief summary of what you do for your program?
We are a three-shift, 240-some company. So, and a lot of people have been there 20, 30 years. So we needed something that was soft and friendly, and a lot of family members work there. So we gear ours toward treats and fun food things to eat, that the company will provide the snacks that Colleen and the other representatives that we meet with come up with different plans. And this way, everybody's getting a healthy thing to eat. We have billboards on what they're eating. Instead of this, they're eating that. And we're still in infancy, so pretty much that's what we've been doing so far.
Have you done anything to encourage increased activity? And I'm not saying marathons, but things like walking at work, that sort of thing?
Yes, we've Colleen and I are working on a walking path around our building, and we've already contacted a contractor, and next month we're having a basketball court put in our parking lot.
Oh, awesome. Excellent. So, Colleen, as you work with this group, I mean, they're at the beginning stages of introducing wellness into their culture. How do you work to augment the corporation's desire to move people along a continuum of wellness?
It's really just bringing in education to people. Again, we live and breathe this every day, and they live and breathe their business every day. So it's bringing a lot of the information that they can truly use. Again, we can all say that we know what the fried fruits and vegetables are, or how much water you should be drinking, but until you actually bring the educational materials and start having it available to you, people don't really realize really what they should be doing. So again, it's having that soft touch, not being the forceful person. When I walk into their break room, they see me and they hide their soda. It's okay to have that, but make sure you're flipping that with some water throughout the day. So again, it's not being the Nazi. It's not being, everyone's got their struggles. We all have it just as well as the employees do. So really, again, as Julie had said, really having that soft touch with people, making sure that, everybody has to find a balance in what they're doing. And really just making sure that they know that it's okay to, indulge in maybe that treat that they have, or when Julie provides the cheesecake, instead of doing full pieces. We do now just bite sizes. Again, like I had said around, of drinking choices of drink this, not that. It's okay to indulge in that soda, but what are some other ways that we can incorporate some water maybe into your diet, and how much really should you be drinking? So again, it's that soft touch of really just helping them understand of just making small choices can have huge impacts.
So Angeline, you're much further down the continuum. You've had your program for a longer period of time. You're in a related field to health. Can you tell us about your program?
Yeah, we certainly focus around metrics. So we've partnered with BSG. I saw Michelle out there. Thank you, Michelle. We have worked along with Aurora to really target chronic conditions and areas that we can make a large impact on the overall health. So as it relates to absenteeism at work, we really try to take a strategic approach, a caring strategic approach to target those areas and make strides. Where we're at now is we have that wonderful platform and foundation in place, and we are looking more at incentive outcome-based avenues and options for our organization. So.
Excellent, great. And Rhonda, how do you work perhaps differently than Colleen in her role with Burlington?
Really, we're not too different. We have to assess the culture of the company because every company has different needs. But I would add to Colleen's, really an important aspect of our job is building relationships with employees. And it's something that really takes time. If you can imagine your own selves just going up to a complete stranger and dumping out all of your medical conditions or issues, you probably wouldn't do that on the first day that you see the nurse at your company. So relationship building is probably our number one focus.
Excellent. Yeah, I noticed you guys weren't willing to share your deepest and darkest secrets to me the first time having met me. Maybe the next time we can get to that. So as you talk about wellness, there's been a lot of talk about return on investment. Many people in the wellness industry now are talking about return on value. Measuring it and showing an ROI can be difficult, but I think just inherently, we all know that there's value. There's cultural value in recruiting and just having people have a place to come to talk about these issues. So I'm going to ask the question of the employers. Do you believe that there's a return on investment for your employees? And if not, how would you define the return on value? Why don't we start with you, Angeline?
Given the fact that we are in healthcare again, in dental, I absolutely would expect employees, whether they're current or from a recruitment standpoint, that they would expect that we would have a robust wellness program in place and that would be at the forefront of our minds.
Excellent.
Ours is, again, in an earlier time, so I don't really see too much of return on investment, but I do see relationships building up with Colleen and the employees. We had an employee who would just kind of greet Colleen every once in a while and see how she was doing when she was there, and eventually she gave him we had blood pressure testing last month. He had high blood pressure. She got him into an appointment, and he is now eating right and taking medication. And on this past Monday, he called out one of his other coworkers who was having something she shouldn't have, who also has high blood pressure. So for me, that's huge.
So let's talk about commitment to the program. How important, and Angeline, we'll start with you, how important do you believe it is to have executive level commitment, not just to support the program, but to lead by example? And has that had an impact on your organization's wellness programs?
I certainly believe that there's that it's necessary to have that top level buy-in and to lead by example, as you said. Our CEO is more than willing to participate in some of our activities, speak on behalf of how important it is to not only him personally, but for our staff and their families and dependents. I mean, we're a family business, and so it's important that it's not just our staff members, but that we reach out to their families and really change their lifestyle, not always just the food choices or increase their steps or things like that, but really take a comprehensive approach to it.
And then so, Rhonda, so as you're interacting with the associates of Dental Associates, do you have much interaction with the executives? Do they come in, and how do those conversations perhaps differ than the conversations with the associates, the other associates?
Yes and no. Depends what, they're no different than their employees. If they've got health concerns or issues, they access our services. It all depends. There's been some at Dental Associates, but I have other companies as well that I deal with, some of their top executives. And it does make a big difference from our point of view, too. We can tell the companies that have engaged management more so than other companies. And it makes a big difference. Right? Wouldn't you say so, Colleen? Yeah.
So Julie, how did Burlington get started? Was this a top-down approach where the executives came to you? Was this something you introduced? And how has the relationship of the program with your executives evolved over the time that you've had the program?
Well, we had the previous HR managers left, and when she did, we also had some other changes. And one of the tasks I was put to was to get the wellness program going. As I said, we had a program that was a little bit more stringent, so something a little bit more family friendly. And I like to plan parties, so I was the right person to do that.
Oh. So where do you see your program going? Where do you see your program going next? I mean, so you're putting in the basketball court, you're working on trying to get a walking path. As you think about the basketball court and think about you liking to plan parties and events, how do you expect to leverage that with your associates to get them more engaged?
We're taking their suggestions. I think that's one of the most important things, that whatever they're offering up, we're trying. Somebody said we should do something to increase how much water we drink, because we don't. We are a coffee, soda workplace, and our company actually sponsored some wells in Liberia. And so we had a water bar one day, and one of the suggestions, I think, from Joni, and we had water bottles out, and people put fresh fruit and vegetables in there, and it was just something that they started doing just a couple weeks ago. An employee brought that up, said we should do that again. I'm doing it with my family, and it's just, like I said, just little tiny pieces out there. That's all it takes.
So, Angeline, what percentage of your employee population would you say are engaging in a positive way with the program? What percent are sitting on the sideline, and what percent are on the sideline but off in the distance and resistant? And then the follow-up question to that will be, what types of strategies and tactics are you using to engage a broader cross-section of your population?
So to begin, Larry, I don't have percentages per se. I guess it kind of depends in what way I'm looking at it. But one of the strategies we're using to measure engagement at a higher level is an outcome-based program. So really focusing on staff member accountability, where they don't have to participate, but we are going to support them and encourage them to do so. And they will have, their own weigh-ins and things like that they have to self-report. And then hopefully we can find the right incentive to tie around that. So that's really where we're looking to become more aggressive. in
So,
our.
so when you say incentives, what are some of the examples of incentives that you're using? I mean, there's the carrot, there's the stick, there's
Premium.
embarrassment, public humility.
No. We're not looking to do that. But some of the strategies and thoughts we've I guess looked at would be premium share. So looking at some employer maybe boost in the premium. Tobacco cessation is another thing we've looked at. Just several different, really where it hits them in the pocketbook, I think really sends a strong message home that, hey, if I do participate and take part in this, it could help me even financially. And not even starting there, but maybe their health claims and things like that. So really kind of tie the overall concept and strategy to them.
And then, so Colleen, as you think about engagement at Burlington Graphics, it's in the early stages of wellness development. It doesn't sound like there's a metric-driven program. Right now, you're about engaging, starting the conversation, and that's where we all have to start. As you work day in and day out to get people more excited about wellness and engaged and moving more, making better choices, what type of conversations do you have with the associates? I mean, how do you kind of get their attention without sort of turning them away? Because it's not always a comfortable conversation.
No, it isn't. Just generally not always a comfortable conversation. Again, it's all about, as Rhonda had said, about that relationship building. I think honestly, some of the biggest, the best place that they have put me really is in their cafeteria. So the way I stagger my visits, I hit people that are coming off of third shift and first shift, and then second shift and first shift and second shift when I straddle my other hours. And again, having them see me in their break room, being kind of non-obtrusive. When you just start a conversation with somebody about the weather, sometimes it leads to, oh, you're the person, can I ask you a question? And then once you establish a relationship with one person, you help them find, it might just be they were looking for a provider, or they weren't quite sure if they should take their daughter in for, they think they have pink eye. Whatever the case is, once you develop that first relationship, they go and tell another employee, and they go and tell another employee. So really, once you start establishing and they realize that really that nurse isn't scary and it's not going to be punitive and nothing is shared back with the employer, once they start developing that trust in you and just, again, being honest with them of sharing, I too am a Mountain Dew drinker. I try and limit myself to one a day. Once you start, of them seeing you as an equal and as not somebody that's going to be punitive to them, it makes a huge difference. Also, by doing some different activities with the companies, it's another way that we have an opportunity to develop those relationships. As Juliet shared, the first quarter of 2015, we had done blood pressure screenings. This next quarter, I'll be offering body fat and weight to them so they can come and actually really find out what their numbers are. We can kind of start establishing more of those relationships for people that are wanting to start on a wellness journey, start on maybe even just losing a couple pounds. How do I even do that? And then the next quarter after that of the year, we'll be working more on developing an actual wellness program. Hopefully, the basketball court at Burlington Graphics will be a little bit more in full swing. So just having some more of those kind of large motor activities where we can, bring people in if they want to. Again, not punitive. They don't have to come see me, but once you have one that starts and you have the one voice that is willing to realize that I'm not scary, it really does just kind of start to snowball.
So as you think about one-on-one engagement, have you the ability of doing a contest where it's one-on-one with the case manager, a game of b-ball, and you can take down the case manager?
I did play basketball in my younger days. But there are still limits.
So
5K is really just more of my. So if they want to go out on the trail, and I know that there's a bike trail there, I can probably do that.
Yeah, I can outrun them, but I'm not going to outplay them in a game of basketball. Right. So, we had talked a little bit about, from Dental Associates' perspective, the importance for recruitment and retention of associates. So, Julie, have you gotten to the point where you feel that what you're doing is a positive retention tool, and has it played into your recruiting efforts at all?
At this point, not so much. During the orientation, we do let them know that Colleen is there twice a month and that It's okay to talk to her. She is very respectful of the time that she spends with them, but I think we're just too soon.
Okay. So, Rhonda, as you've interacted with Dental Associates, have there been ideas that you've brought to the table to enhance the wellness program that they offer?
Well, I know last year Jill was working on a wellness calendar, and so, and I think Aurora and Dental Associates kind of work hand in hand on that wellness calendar, and we also do the same initiatives that Colleen does. So we're trying to, across our on-site nurse program, do the same thing at every company, offer the same wellness initiatives every month, and then the same quarterly initiatives, which are usually some type of a screening of some sort. So Dental Associates gets the same.
Okay, so you've
wellness.
Standardized, for your part,
Yep.
the Aurora role so that you're
Yes.
consistent across the organizations in a way that you know to be impactful
Right.
For the associates and the employer.
Right, and it's really nice because, when all of the on-site nurses communicate, we learn what works for somebody else and perhaps steal that idea and use it at our own companies. So that dialogue is always ongoing. But I will say that matrix effect is a big deal in our role because if you can get somebody engaged and get some positive results, they start, they're out in the company talking, and so it starts bringing more people in. And I've been at Dental Associates long enough now that people are finally comfortable with me and coming in
Great.
and really utilizing our services.
So, Angeline, before I know whether or not this is a fair question for you, I need to know, how long have you been at Dental Associates?
7 years next month.
Okay, so and when did the wellness program start?
Really robust, more data-driven, formal program, I would say 2011. We started planning that.
Okay, so help me understand where you started, because you were there at the onset, and incrementally what it took to get you where you are today. What were some of the milestones along the way as you introduced more complexity and value to the program?
We talked about buy-in and support at all of our locations. So today we have 12. At the time, I believe we were 9 or 10. So we're growing organically, and because of that, we really wanted to have a presence at each of our clinics. So we developed a wellness steering committee, which actually has an organization chart. We had a kind of position description so staff members could understand what did it mean to be part of our wellness committee, and then do you want to be part of it? So we had kind of an application process, which we went through. So we developed that formal structure, and then from there, we really partnered at great lengths with Michelle at BSG, and we worked on the data side of it and the metrics around it. So we have a dashboard that we use for planning every year. Another really important strategy that Jill implemented was a health interest survey. So we survey all of our staff members, consolidate that data, and then really understand what gets their attention and their engagement in our programs. What do they want to see? And then how can we implement that and reinvest that back in?
So along the journey, were there areas where you perhaps made some moves that, in retrospect, you'd reconsider your positioning of the programs? What were some of the pitfalls that you ran into and learned from along the journey?
I would say working on the accountability side a little bit sooner than maybe we have. And again, it's a cultural shift, and communication is another thing that we could have strengthened along the way. But I certainly think that you have to be cautious about your culture too, and not be too progressive toward your staff, or they're gonna back away and feel like you're big brother thrashing them for bad choices that they're making or their lifestyle choices.
So when did you first know that it was working? It sounds like you've developed a metric-driven plan. I guess what are some of the measures within the metrics, and how did you define success relative to those metrics?
We took a look at primarily some of the top chronic conditions that we were experiencing and tried to develop strategies and programs around those. So we had some decreases there, some slight decreases. We had higher level participation over time. So those were some of our key indicators that some of the strategies were working.
Excellent. So, Rhonda, as you think about chronic disease management and helping people be as healthy as they can be, given their conditions, can you share with us some of your experiences in terms of how you interact with those associates and maybe some success stories?
Sure.
Without violating PHI,
Right.
of course.
Right, so I have to really think quickly here. First of all, okay, so to kind of go a little bit backwards, it starts with the relationship building. Sometimes it's just a simple conversation about the kids or the dogs or the vacation. And then it's maybe just before they leave, you'll start talking about their diabetes. And, oh, by the way, I never check my blood sugars. So that might be the end of our first conversation. And then we could connect again telephonically, through email, or on site again. And generally, that's when we get into maybe more of the disease process, and we establish some short-term goals. And if we don't meet those short-term goals, what could be some consequences to them? This is how we interact. And I'm thinking of somebody in particular. She wasn't even connected with a family practice doctor that she liked. So that was a communication breakdown. And she had absolutely no connection with a specialist. So, by my interaction with her, we connected her to these two providers. And she's doing very well. I just saw her yesterday, and she now checks her blood sugars every day. They're still high, but they're half of what they used to be. They were in the high 500s, and I think yesterday she was telling me they're down to about 325. So I'm happy with that, even though that's significantly high still. We're still working on it, and she's now on an exercise program as well, walking.
See, wellness, I found that wellness is great for people that are well, but the people that really need it are
Right.
people like that.
And it's really nice to get involved early. Mm-hmm. So with these pre-diabetics or these early cardiac patients, it's really nice to get involved in their lives early, because that's when you can make the biggest difference in terms of lifestyle change. If we can get them on an exercise program, perhaps lose some weight, they may not have to be on any type of medication, insulin at all. So they're really our number one target.
So Julie, your wellness program today, we heard from Dental Associates that they've got an actual wellness committee. It sounds like you're a wellness committee of one right now, or is it broader than that? And have you given some thought to where you might take it next to involve your associates, not just in the engagement in wellness, but the engagement in driving the program?
Well, we are an employee-owned company, so I have incorporated our ESOP committee into this program as well. So when I meet with Colleen and the other representatives and we brainstorm with different ideas, they're my little helpers with getting all the information out there. We have some events that we have on a regular basis. We have cookouts 3 times a year, and last year, each time we had a cookout, we took out something that wasn't so great and put in something that was a little bit better. And they actually say, "Did Colleen okay this for us to have?" And I just
They really do like me there.
They do.
What I've heard, they like me.
And I just say, she always says anything in moderation. But it's kind of like they're calling me on it too. When we handed out the cheesecake, it was National Cheesecake Day. So we got the little tasting ones from Sam's Club.
There you go.
And they were like, "Is it okay to have this?" And I'm like, "As long as you don't have the whole sheet, you just have one, that's fine." And and so the committee helps me get all that information out there.
For the record, Costco's got better little cheesecake squares.
Oh,
Just
do they?
so you know.
Okay.
I'm a
I'll try
Costco
it out.
person. It used to be Sam's Club, but I'm Costco now.
I'll give it
So, I took to heart the advice of our prior panel, and I left my cell phone at the table. So I'm going to ask for a time check. It's 10:20, 10:22. And what time were we supposed to go to? 10:30. Okay, perfect. So My next question is more open-ended, and I'd like each of you to answer from your own perspectives. So an organization in the beginning stages of wellness, a more advanced organization, and then our two case managers from their perspective. And it's what advice, understanding that we've got a full spectrum of employers in the room, what advice would you give like-situated employers in the room, or perhaps in your case, Julie, employers that haven't even started the journey yet, in terms of maximizing the value of not just their wellness programs, but the impact that they can have on their associates' lives?
My advice would be to try it, even though it hasn't succeeded in the past. We have employees whose spouses, family members work somewhere else, that they have a different situation and nobody does it, nobody cares. Or we had ours at Burlington Graphics and it didn't work very well. But we tried it again, and we just tried a different outlook and a different situation, and it's working. And whatever the employees suggest, we try it. And why not? Because if it doesn't work, then we won't repeat it. But we've had requests for repeat events. Why don't we do this? Why don't we do that? We have a picnic in the summer, so we're going to have some events there. You know, just try it. Don't be afraid.
And then Rhonda and Colleen, maybe you guys can tag team this one from your seat as healthcare professionals, you know, on the front line in the work site. What advice would you have for employers?
First and foremost, for management to be supportive. The employees, we generally get very, very great feedback. They're so appreciative of our services. Not only do we do wellness education, but we also help them find in-network providers. We help them maybe give them recommendations of referral specialists. So they really value our opinion, and but management really has to be supportive, allow them to take the time to come and talk to us. And they love it. They love that we come to them and that they are kind of in their own work environment. They don't have to take off of work to see it. And we can spend more time with them generally than what their physicians in the office can. So.
From my perspective, I think it's really just listening to your employees, and as Julie had said, really just engaging them in the process. What your ideas think are fantastic may not work in your company or plant or whatever your place of business is. So again, really engaging your employees, asking them, what would you like to see? How do you think the changes will go over? Also, in just realizing that everybody is on a different journey. So small changes of, if we work with an employee and they start just bringing their lunch 2 times a week, or they flip 1 soda for water that day, all those little changes make big differences. So a lot of times we talk about the catastrophic things, the heart disease and diabetes. And as Rhonda had kind of said, even though those are horrific, that can really hit the pocketbooks from the employers, we have to remember the other employees that are kind of teetering, that are maybe in their 20s and 30s, that aren't making maybe some of the greatest choices. And really, again, just having them realize that, again, that wellness is a journey. We fall off the bus, we get back on, we dust ourselves off, and you start hitting your 40s and things getting a little bit harder to maybe lose those extra pounds, or, life gets in the way where we're busy. Everyone has busy lives. You're raising kids, you're potentially, caring for older parents now. It's really trying to start earlier in your 20s and 30s, really making wellness something that's important, that's going to carry you, so that when you're hitting the 40s and 50s of, well, now where do I start? I'm afraid to go to a gym. Where do I even go to? So wellness encompasses a lot of things. It may just be, like I said, for that person, making enough choices on the weekend to make sure that they're packing a lunch, or is it going to the gym? So again, just having employers just being supportive, and just giving things a try, as Julie had said, and really incorporating them in the process.
Excellent. And Angeline?
And I would say I certainly agree with a number of things that were already shared, but really listening. Listen to your employees and gather their feedback and their interests, and that's a really good starting point. And then they know that we're hearing them and that we'll do our best to try to align what they want to see to what we plan for. Another thing is measurements. So we might seem a little over the top with our metrics, but what we can't measure, we don't know what is success then? What does success look like for our staff and for us as a committee? And then just really don't become discouraged and have maybe too lofty of goals. Be realistic and take things in phases to make sure your staff are with you along the way.
Okay, one last question, and I think we'll be ready to wrap it up. We've talked a lot about worksite engagement. I think we've talked a little bit with our nurse managers about reaching into families and trying to change behavior there. And this isn't necessarily a question for everybody, but whoever's got experience and is comfortable answering the question, what are some of the specific things that you're doing to engage family members in the process?
Well, at Aurora, each of us nurses are assigned to a particular company, and I have the ability to run a census report on my employees, so I can see, even if it's a family member, if they have been inpatient, and I use my nursing judgment, my case management experience as to whether or not I should reach out to them telephonically, and oftentimes I do. So even it might not be the employer, or the employee rather, and it could be their spouse, I'll reach out to them.
Excellent.
Mm-hmm. And if it's a child, depending on the age, we'll either reach out to the parent or to the child if it's an adult child.
Again, and I think the beauty of this program also, as Rhonda has shared, is that we have the ability to interact with the family members. So there's many times when we're on site at the employer sites where they'll come up and say, would you speak with my wife? My wife has been struggling with this. So we have the ability also to engage them in that respect, that if they have a member identified need, we have the ability to engage them and become a part of their lives as well.
Excellent. So I think that brings us to the conclusion. So I'll leave you with this before I thank our panelists. So my parents always used to say, you can never be too thin or too rich. And I think you could argue the point on both of those. But in reality, you can never be too well. It's something that we all strive for. All of us are at different stages in the wellness journey. Some haven't even started it yet. But it is so important. And from an employer's perspective, you've got the front row seat. From an insurance company's perspective, most of our interaction with your associates and their family members are telephonic. God only knows we kill enough trees through letters and EOBs, but we don't have that day-to-day contact, eye-to-eye, with your associates and the occasional contact that many of you have with their families. So to meet them on the front line and be able to look them in the eyes and engage them in the conversation is the most powerful thing that you can do, and you're in the best position to do it. I mean, we don't even see our doctors, for most of us, more than a couple of times a year, if that. But you're on the front line, and to solicit the help of professionals out there, do what you can with what you have, but when you start engaging health professionals in the process, the conversation goes to a much different level. I'm certainly not comfortable calling up somebody with a chronic condition and having that conversation with them. But Rhonda and Colleen do this for a living, and they are. So it's a big value to you, your organization, and most importantly, the well-being of your associates and their families. So Julie, Rhonda, Colleen, Angeline, thank you so much. We appreciate your time and putting yourself up under the hot lights. So appreciate it.
Thank you.